Hello, my name is Anna Meyer. I'm a pediatric otolaryngologist in San Francisco, California, and we'll spend the next several minutes discussing tongue ties in children. Tongue tie, sometimes called tight frenulum or ankyloglossia, is commonly identified in newborns and infants, and sometimes is recognized later in older children. People with tongue ties may have feeding problems as soon as they are born, may not have troubles until they are older, or may never have any issues. In most cases, tongue ties can be easily identified and treated if they are causing problems. For breastfeeding, the tongue needs to be able to extend enough to allow a good latch to the breast. In some children, a tongue tie will limit the ability for the tongue to move and will make latching more difficult, painful, or affect the transfer of milk. Some babies have a tongue tie and it does not affect their ability to breastfeed. While bottle feeding requires less suction, some babies with tongue tie can have trouble getting a good latch on a bottle as well. Tongue tie may also affect the ability for older children to correctly say words, especially words that require the tip of the tongue to touch the front of the roof of the mouth, such as la, da, and ta. Lastly, tongue tie can sometimes cause social anxiety for children and teenagers because their tongue looks different and cannot move normally. Some newborns with tongue tie have trouble latching well right away, and the latch may be shallow. They may have clicking while latched, they may slip off easily. The mother may have pain and the nipple may look compressed after nursing. Feeding sessions may be prolonged and the transfer of milk may be less than necessary for good weight gain. Other infants will feed well, but the mother may be suffering from worsening pain and irritation of the nipples. Some children will have successfully breastfed but have speech that is harder to understand than other children. Usually this is able to be identified by age 3. Tongue tie does not cause a delay in speech. It only affects what the words sound like. Occasionally, older children will complain of difficulties with social activities such as licking an ice cream cone. Signs of tongue tie when looking in the mouth are a band on the underside of the tongue that prevents the tongue from lifting, moving side to side, or coming out of the mouth. The tip of the tongue may be heart-shaped. Milder types of tongue tie, called posterior tongue tie, have been described, but they have not been studied very well. All children with breastfeeding issues should have an evaluation by a qualified international board-certified lactation consultant and a physician to ensure that other causes of breastfeeding problems have been identified. Infants who have tongue tie and the problems with breastfeeding just described often will have improvement in feeding when the tongue tie is clipped. This procedure is called a frenotomy. In infants younger than 6 months of age, it can usually be done in the clinic without any sedation. Older children with speech issues typically need to be sedated in order to do a frenotomy, and they will usually have stitches under the tongue, and these will dissolve over the following week. Adolescents and mature older children may also be able to have the procedure done in clinic. Several techniques have been used for performing a frenotomy, including scissors and laser. No technique has been shown to have a better effect, and laser does have a risk of burns that scissors do not. In conclusion, tongue tie is a common cause of breastfeeding problems, particularly painful latching and problems with maintaining the latch. Frenotomy is a reasonable procedure to consider for an infant with those issues. Older children with particular problems in pronunciation or social concerns can also be considered for frenotomy. All breastfeeding infants would benefit from excellent lactation support and a complete evaluation by a physician if they are having breastfeeding issues.